The Pathology Center was, I believe, started by Dr. John Schenken in, I think, the 1940s. And Dr. Schenken was a literally nationally and world-renowned pathologist. We've been in this location now since the inception of Methodist Hospital's original build here. Some of the rooms we have, such as the room where we do anatomic pathology, has been unchanged since I was here for my residency. And in fact, we're using the same exact space now to process a much larger and more complicated surgical load than we did then when I was cutting tissues in that area of the laboratory way back in the 70s. Because it's a field that is not so much in the public eye, it's not immunized as much as other fields from things like funding cuts at the national level, from perhaps difficulty in attracting new talent to the field. We're confronting a huge gap in trained people to work in laboratories, particularly medical technologists, who we do desperately need. So I think it's important for people to know that it's a very valuable activity. It produces 70-some% of the data in the medical record. It's extremely important diagnostically and therapeutically.
This laboratory that we're currently in was built in the 1960s and hasn't really had any extensive remodeling done except in one area, which was about 11 years ago. There's areas in the laboratory where you open a refrigerator, that stops all traffic moving down that hallway, refrigerator door or any other door. And so they have to go out in the hallway and come back in another door. It's approximately 22,000 square feet, and the lab we're in the process of building is approximately 40,000 square feet. We're working on a system here to have cooling in place, have air handling in place, because we're going to have a biosafety level 3 laboratory in this laboratory. And it's important that the air handling not be disrupted in that kind of a laboratory. We've also had to add numerous spot air conditioners in this area to handle the heat load, which gets expensive. Now we're out of room to add more air conditioners, and we will have modern, up-to-date air conditioning capabilities in the new building. We're going to add a lot of security features as well to the building so that our staff feels more comfortable, and then we also help protect some of the areas that we are interested in making sure other people don't have normal access to without some kind of control measure. Laboratory testing results account for 70 to 95% of the total medical decisions made in a hospital environment. Our ability to deliver cutting-edge laboratory services could mean the difference between somebody living and dying.
We had a medical technology educational program here at Methodist Hospital since 1968. It was our first year with students, and we basically trained the medical technologists how to do all of the laboratory tests that we do here in the lab. And these are college students. When they finish the year, they will get their baccalaureate degree. So they've pretty much had a pre-med background before they ever get here, and then we spend a year with them. They're here 40 hours a week for a full year, and we teach them all day long how to do patient care. They are actually hands-on experience of doing the lab work under the direct supervision of an instructor, and we give them lots of exams. They get 39 semester credit hours for this, and it basically counts as their senior year of college. Get their total curriculum, except for some of the lectures that we share with the medical center. All of their clinical education is right here in our lab, and they get the hands-on experience working with our techs and all the patient samples that we have here. There's one thing about medical technologists: we are very detail-oriented and organized, and so we're very dedicated to making sure we're doing everything correctly. But I think it sometimes can add to the stress level that we're experiencing, even though I don't think it's causing us to give out inaccurate results. I think it increases the stress level when there's just no space for moving around, or when you're feeling a little crowded in the way we have the equipment set up due to space limitations. We're very excited about the new building, not only for the school but for the whole lab. I think there's a lot of excitement. I think it will be wonderful for morale, for everyone to have a brand new space designed the way we need it and not working around the space constraints that we have now. So I think all of those are really good things, and it will allow us to do some new things that we possibly haven't been able to do currently with the way the lab is set up.
Well, if you look inside this room now, we've got columns that take up a lot of eye space. So you can't really see from one end of the lab to the other to see how busy the other people are. Maybe they need help. And there's times when, we're bumping into each other trying to get from one place to another. So we're hoping with the new facility, especially with our automated instruments and our pre-analytical setup and how it handles specimens, that we'll have more room so that it will give us easier access to get from one place to the other.
It's been difficult with the 4 or 5 people inside the room, just the assistants, the pathologist assistants and pathologists. And we're just bumping into each other a little bit here and there. Very difficult to maneuver around. We have plenty of chairs, so we try to keep people sitting and do some work just in stationary areas because of the high traffic flow that we have in the room. The anatomical area that we have is going to be double or if not triple the size, which is going to get a better workflow that we have. From the specimens coming in through the door, set in the spot in one area right there, and moving down a line to the processing and then getting to the histology area. The pathologist assistant will be able to have separate hood areas to work individually with the pathologist to actually work on the larger cases to help the surgeons and patients out. The more room we have, the more storage and actually the better care we can do for the patient.
As medical director of the blood bank, one of the things that we are really working on is to work with the medical staff and our laboratory staff, medical technologists, as well as our coordinator of the blood conservation program, Daryl Guzwa, to make sure that blood products are used appropriately. There isn't really as much space as we need in the blood bank area. In our current laboratory, in the current blood bank, of course, we have refrigerators that have blood products. We have to keep them at a certain temperature, monitored very carefully. And we also have a lot of highly trained technologists who need space to work. And we also have a lot of automation now in the blood bank as well. And as far as screening for antibodies and for typing. And we also have an irradiator, a blood irradiator that is used for irradiating units of blood when it's appropriate for cancer patients and our young patients, the neonates and children that we transfuse for Children's Hospital. Blood bank, we have zero tolerance for errors. I mean, it is literally, we cannot allow any errors because of the giving a patient the wrong type of blood, the wrong unit of blood can be very serious and can cause death. So we cannot tolerate any errors. So having a workspace, having an area that is conducive to a nice workflow, to an environment that allows our techs to have the time and the space and the equipment to really work in a way that they can do their job better, improves patient safety.
Molecular diagnostics either looks at the genetic blueprint of the human being or of microorganisms. The advantages of molecular testing, one of the main ones is that it's so much faster to detect diseases caused by bacteria or viruses. So then the patient can be treated immediately within a few hours. MRSA, methicillin-resistant Staph aureus infections, that's a big thing now in hospitals. People are switching to molecular because we can detect in less than an hour if you have it. It would take 2 days to a week to grow it in culture in the micro lab.
By and large, no one knows we're here. In a way that really is, it's more humbling than someone knowing you're here, because in essence they don't see you and they just trust that you know what you're doing. And you need people who have high idealism and a lot of motivation to work in that setting, to come to work every day and do the best they can, because they do know that there's a patient at the other end of the specimen.